we are talking about disorders of gut-brain interaction, which, as all of you probably know, is the new umbrella term for this group of disorders that was previously called functional gastrointestinal disorders. And the idea behind this is to really highlight the pathophysiology of these disorders, where gut-brain interactions are highly relevant. And as you know, we can divide these different disorders into different anatomical regions based on the presumed origin of the symptoms. And this is a group of disorders that are classified by gastrointestinal symptoms, but they can be related to any combination of motility disturbance, visual hypersensitivity, altered mucosal and immune function, altered gut microbiota, and altered CNS processing. And when it comes to disorders of gut-brain interactions and food, food is definitely central for patients with disorders of gut-brain interaction. And this has mainly been studied in IBS. So therefore, this talk will mainly focus on IBS and food, but also to some extent on functional dyspepsia and food. But food is probably of relevance for the majority of disorders of gut-brain interaction. But we know most of this so far when it comes to IBS. And when it comes to IBS, it's quite obvious that food is central for patients with IBS when you look at the literature. When you look at different surveys, 2/3 to 3/4 of subjects with IBS clearly report a link between food and their IBS symptoms, worsening or exacerbation of their symptoms. And if you ask patients with IBS what they would like to know more about, food really comes high on the list. They would like to know more about foods to avoid. It's the top item that they would like to know more about. And when asked whether there are different trigger factors behind their attacks and episodes, food factors related to food also come high on that list. So eating too much food, ingesting fatty foods, dairy products, and also drinking caffeinated drinks are considered to be important triggers of attacks or episodes of IBS, together with stress at work and psychological factors. So food is central for IBS and other DGBIs, and also dietary advice then is also central for these patients, which we'll come back to.